The Closing the Gap podcast is produced by the Association of Nigerian Physicians in the Americas and is supported by the association, sponsors, and advertising. Hello, everyone. Welcome to the Closing the Gap podcast brought to you by the Association of Nigerian Physicians in the Americas, also known as ANPA. My name is Dr. Susan A. Dionwe, and I will be your host for today. Today on our show, we have Dr. Clifford Eke with us. Dr. Eke is a board-certified general thoracic surgeon at Kaiser Permanente in Fontana and Ontario, California. He is an undergraduate of the Baylor University in Waco, Texas. For all of my Texas listeners, you know why I mentioned that. He received his medical degree from Loma Linda University and completed his general surgery residency at Loma Linda and his postdoctoral fellowship in general thoracic surgery at Kaiser Permanente in Fontana. Dr. Eke is an assistant clinical professor of surgery at Loma Linda and works at Kaiser Permanente Hospital in Fontana. He is a fellow of both the American College of Surgeons and the International College of Surgeons as well. Dr. Eke has a quite decorated resume. He has served as the past president of the American Cancer Society in California, and he is the founder and CEO of Chima Medical Missions International, which is a nonprofit that provides free general medical care and surgical services in Nigeria. He's a magnanimous volunteer and philanthropist who has received numerous awards for his achievements and contributions, and he served as the chair of the Medical Missions Committee for ANPA and has been quite instrumental in leading our medical missions and surgical missions and has been a true pioneer in this space for ANPA. Speaking of ANPA, he served on the executive committee in many roles, including as treasurer, president-elect, and as of June 2024, he is now the president of the association. Dr. Eke, welcome to the podcast.
Thank you, Dr. Susan Edionwe. Thank you for the very nice introduction.
My pleasure. It's truly, I'm very excited to be interviewing you. And so the first question I have, we understand that your administration, as I said, began in June. How has it been so far? What has your experience been?
Well, it's been exciting. It's been a lot of work. It's been a lot of Zoom meetings and a lot of travels. So, part of the work is I had to meet with not just the ESCO, but the board meetings, and then meet with our chapter and committee chairs to set up agenda and discuss my vision with them and what ANPA will be doing going forward. Among that, also communication with our colleagues in Nigeria and the government institutions, as well as a lot of travels. I was in Canada earlier this month for our sister organization, CAMPAD convention. Later on this month, I'll be going to NAPSA, our pharmacy organization, and next month to MANSAG, a similar organization in the United Kingdoms, etc., etc. So it's been exciting, but very busy, I must say.
And you are incredibly busy also at work, I know, so you're juggling a lot. As you've already sort of alluded to, this is a big organization with a lot of sister organizations and a lot of roles that you have to fulfill. With that in mind, what's your vision for ANPA for the next 2 years? When it's all said and done, what do you hope to have achieved?
Well, if you saw my speech and my slides when I took over, I have at least 7 things, important things, I think, I have for ANPA. So my goals, I can go through them quickly, is people value and respect. Simple concept, but very important, because with this, I want to increase our membership of ANPA to at least 1,000 members by my first year in ANPA. Then partnership and meaningful relationships. Partnerships with organizations here as well as in Nigeria that share our vision. I want ANPA to spend a lot of time on prevention-focused programs with emphasis on education and mentorship. And as you know, we have many of those programs which you can perhaps go into detail later on. But prevention is better than cure, as the saying goes. And for a place like Nigeria, actually, that's how we're going to get our bang for the buck, you know. And then teamwork and collaboration, teamwork among our chapters, our committees, and collaboration, not just with our outside other organizations, but our sister organizations like NPAG, which you are the president of, and ANPA Foundation. Then our finances, we have to improve, and we have ways to make ANPA more financially strong, as well as strengthen our secretariat. And then publicity and media, very important. So I want to thank you for this podcast. That's one of the publicity and the other modes of publicity. So we can share the good works AMPA is doing. And people can then join us and help us to even do more. And finally, AMPA at 30, which we'll talk about more later on, to have a robust celebration and make AMPA a household name in Nigeria.
That's excellent. And you mentioned these goals that you discussed on your inauguration night. One of the things you introduced is a slogan, AMPA Better Together, Better Together, which I thought was so clever. What was your motivation for creating this slogan?
Well, yes, AMPA Better Together, we say it 3 times. A few reasons. One is along the way, we've had elections, as you know, in AMPA, and sometimes they can be very contentious and heated because we are very passionate people. So after some of those things, we lose some members. So I wanted to make sure that we can forego or overcome some of our differences and combine to work together as a team. Because team, for me, stands for together each achieves more. So if all of us can harness all our strengths and work together, I think AMPA will be in a better trajectory. And that's why I thought that would be a good slogan. Also, attending some other sister organizations' meetings, they had slogans. And I thought, wow, AMPA needs one. So this one I thought was appropriate. That's why.
I think it's a fantastic slogan. I really enjoyed hearing it on your inauguration night, and I think it will be beneficial for the organization. So you talked about AMPA 30 early on, and you are the president in this celebratory year. So looking back at AMPA's 30-year history, what do you think have been the biggest challenges that this association has faced, and have they been addressed?
Well, one of the biggest challenges is actually implementing best practices in healthcare in Nigeria. And it's still a challenge, by the way. We've tried to do it in many ways, and one of the ways we've addressed it is what we call our AMPA Week, which we started in 2015 under leadership of Dr. Nkem Chukwumerije. Then I was the chair of medical mission. And we go to Nigeria as volunteers, and we do 3 things. We do education in healthcare. We also do advocacy in healthcare. And finally, we do our medical, surgical, and dental mission free of charge. For transparency, it would be nice if we don't have to do medical mission. The day when medical mission will be less frequent, we all rejoice. But as you know, our healthcare budget is going down. Healthcare system in Nigeria is not really improving. And because of that, we have to do this field activity AMPA Week yearly to address this gap. And that's actually part of this podcast, to address the gaps in care.
Absolutely. And so just a follow-up question for that. Where do you hope that AMPA will move towards in the next several years to better address this gap?
Very good question. So there are some opportunities now because AMPA has partnerships in the Minister of State for Health and Social Welfare. He's actually an AMPA member, Dr. Tunji Alausa. Lived here in the diaspora in the US before going back. We also have Dr. Pate, the Minister of Health. And even the Lagos State Commissioner of Health is also a diasporan. So these have been opportunities for us now to collaborate and go back, not just do our philanthropic mission work, but also think of ways we can work beyond the mission. And two good developments have happened in recent times to facilitate that process. One, we just signed an MOU with the MDCN, which is the Medical Dental Council of Nigeria, that allows us to then make renewal of our Nigeria licenses or obtaining it much, much easier. That process is being finalized. And number two, there's a new development as of the last 48 hours where the National Postgraduate Medical College of Nigeria approved people like you, specialists like you and I, can now become fellows of this college, which entitles us not only to do our clinical work, but also to teach and hopefully improve the number of healthcare workers in Nigeria and help stem the tide of brain drain. So now we're going back with brain gain. If we can actually join this and improve teaching. And something else we can do is technology, like you and I are talking now on the podcast. We can use technology also to affect, teach, and even take care of patients. With our licensing and postgraduate college fellowship, we can do it legally in a seamless fashion. So that's exciting for ANPA and other diasporan organizations.
So to that end, because you've named some really exciting things for any new listeners who maybe haven't joined AMPA just yet, what would you say to them if you could, speak directly to them? What would you tell them about how important it is for them to join?
Well, yes, and there are a lot of them here, which is why we're trying to increase our membership, as was my first goal. First is um, when you join AMPA, you meet people like you, first of all, which is something not too common where we live right now. So people who are going through the same issues you're going through in their practice, in their training. So you get to network with them. You get to have opportunity to become a leader in the organization, either at your local chapter, the committees, or eventually at a national level, which is what I did. I came through the ranks. I actually heard about AMPA when I was an intern uh, in California here through one of the founders, Dr. Chima. Other benefits of joining AMPA is you have a chance to volunteer. Like I mentioned before, for AMPA Week, you can go and give back to our country of origin, to the underserved. And even going forward now, you have opportunity to do that, but you can also have opportunity to establish a practice, either virtually or going back entirely physically with the new developments I told you with our licensing and position in the college. All that if we can do and actually make an income from it if it's arranged properly. So those are the advantages of joining AMPA, and then you have CMEs in our annual meeting where we have speakers talk about all kinds of topics. You get up to 20 CMEs, and then it's also discounted for you when you're an AMPA member. And then you'll be part of the largest diaspora healthcare organization of Nigerian heritage in the world. To me, that's exciting.
It really is. It absolutely is exciting. And I think for any listener, he's made a great case for why you should join. It's an incredible value proposition. Dr. Eke, thank you for giving us your time to interview you. Before we end this podcast, what is your favorite Nigerian food?
I like a lot of them, but I like fufu with ofe owere. It's a special soup.
Uh,
And not everybody can cook it. I'm from Owerri, so ofe owere and fufu is one of my favorites. And fufu is trending on Instagram. So
mhm.
Naija know they carry large. So up Naija folks out there, we're doing it in different ways.
And one for good measure, I know a lot of our members are from Texas, and you, like I said, did your undergrad in Texas. What is your favorite Texas food?
I eat Texas. You know what I used to like was the frog legs.
Ah,
Frog legs before.
okay.
Yes.
I wasn't expecting that one. Okay,
Yeah.
frog legs.
Frog legs. When they make it so well, it's so tasty. It tastes like chicken.
All right, listeners, please do go and try that at this point. Again, like I said, Dr. Eke, thank you so much for giving us your time and for this incredible interview. And we can't wait to see how your next 2 years go.
Thank you. I remember ANPA at 30 in Lagos State, April 4 to 14, 2025. We're going to be doing our mission. Then we're going to have our convention and our 30th gala all at once. Never been done before. Please join us. It's going to be exciting. Thank you very much for interviewing me.
No problem. And at this point, we'll be taking a short break. Please stay tuned.
Transitions Women's Health Consulting LLC is proud to announce the launch of their book titled The Transitions Fourth Trimester Journal, authored by Dr. Janet A. Williams. This self-guided journal was designed by Dr. J, a midwife of 19 years, for new mothers to explore their experiences, self-acceptance in their new roles, and to give themselves the gift of self-care. The journal reinforces self-care and hospital discharge instructions, which make recognition of danger signs easy. It makes it a great gift from hospitals, doctors, midwives, and nurses. Give it to a new mother as a baby shower gift or place it in your baby shower registry. You can get the book at store.bookbaby.com and search for Transitions Fourth Trimester Journal by Dr. Janet A. Williams and enter the discount code 10, that's CODE 10, to get 10% off. The Association of Nigerian Physicians in America, ANPA, is proud to present the ANPA Foundation, a 501c charitable organization with the sole purpose of raising funds to support the association in its mission activity. As a 501c3 organization, the ANPA Foundation also accepts donations including property and estate, stocks and bonds, credit cards, and even cryptocurrency. To find out more about what we do and the lives we've been able to change and impact, visit us online at www.ampafoundation.org. Donations can also be made directly from our website, and as a 501c3 organization, all your donations are tax deductible. Let's empower healthcare together today.
Thank you, listeners, for staying with us to the end of today's show. This has been Closing the Gap podcast brought to you by ANPA, the Association of Nigerian Physicians in the Americas. Remember to follow us on social media. If you're looking for us on Facebook, YouTube, and TikTok, our handle is at ANPA National, one word. If you're looking for us on Twitter or Instagram, our handle is at ANPA_National. If you've enjoyed this podcast, we really encourage you to consider donating towards one of our upcoming medical missions, partnering with us, or volunteering. You can also sponsor this podcast or submit an advert request. To do any of these things, visit the ANPA website at www.ampa.org or send us an email at info@ampa.org. You can also visit our website for details about our upcoming events. Finally, remember to join us next week for another episode of the Closing the Gap podcast. My name is Dr. Susan A. Dionwe, and it has been an absolute pleasure being your host today. Till next time, stay healthy and goodbye.